IVM.
We would like to thank Storytel for sponsoring this show. Storytel is an audiobook platform that lets you hear hundreds of thousands of stories on your mobile, on your PC, wherever you prefer. You can get a great deal by signing up at storytel.com/IVM. But before I tell you what the deal is, let me make a recommendation for you for your first book. When you go to Storytel, search for James Clavell. He has a number of books, but I'm going to recommend Shogun to you. Shogun is the story of an Englishman who's shipwrecked in 16th century Japan and how he struggles to deal with the culture, gets embroiled in the politics of the land. It's a great story, and if it wasn't enough that you can get just this one book, James Clavell's Asian Saga has 5 more books on Storytel. So go to storytel.com/IVM. You can get your first month at 99 rupees a month instead of 299. That's 200 rupees off on your first month. Storytel.com/IVM. Go check it out.
Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to All Things Policy. I am Sunila, and today I have with me Apurva and Sarthak, and we are going to be discussing the budget allocation towards health this year. And we will be talking about the buzz that has been going around the 137% hike in the budget allocation. And we will try to get into the details of how effective the hike actually is. So welcome Apurva and Sarthak.
Hi, Sunila.
Hi, Sunila.
So, Apurva, recently the economic survey for 2020 to 21 came out, and it shows some interesting findings about the pattern of spending on health in India. What do you want to say about that?
That's right, Sunila. So we have an entire chapter in this year's economic survey on healthcare spending, and some of the findings have been quite interesting. The first thing that I should appreciate is that they have quoted a lot of health economists. So bonus point to them on that, because they have quoted the famous 1963 paper by Nobel Prize winner economist Kenneth Arrow, who talks about healthcare spending. And one of the policy solutions which the economic survey recommends to the government is this, that you need to increase the public spending to around 2.5 to 3%. This is exactly the same number which the National Health Policy of 2017 also recommends. And one of the rationale that this document gives is that because of market failure, there is a lot of out-of-pocket expenditure. So in order to curtail that, in order to address that problem, there has to be a massive public spending. And more importantly, last year was a pandemic year. So the spending has to increase manifold to address some of our healthcare fault lines that we have seen over the past 10 to 12 months. That was something that was very interesting. Another important and very interesting aspect was the healthcare infrastructure. And they have they have used the data from different countries, and the authors of the survey claim that the health infrastructure should be sound, but it should also be agile. Agile in a way that they should be able to address or counter problems such as COVID-19. So the infrastructure has to be agile. And they have recommended that a lot of spending should go into building this agile infrastructure with respect to capital infrastructure, buildings, staff, health informatics, and stuff like that. So these are pretty interesting things. I'm not sure, and that's what we are going to dive into in a short while. I'm not sure how much has this this has been translated into the budget speech by the Honorable Finance Minister. But before that, Sarthak, do you think, what is your reading of the budget, and how is this different from the budget and the expenditures or the revenue statistics of last year?
Thanks, Apur, for asking this question. So generally what happens is whenever the budget is out, people talk about what are the new schemes, what are some of the new programs. They will always talk about the different kind of budgetary allocations. Budgetary allocations here refers to what is going to be the budgetary estimates, how much money the union government will be spending on different kind of existing schemes, or how much money it will be going to spend on some new schemes in the next fiscal year, right? But we typically tend to forget that there are some other numbers in the budget as well. For example, within the budget, you will also have the revised estimates for the previous fiscal year. For example, in this budget, so you will have the allocations for 2021-22, but it will also have the revised estimates for 2020 2021. So last year, whatever was claimed, whatever was spent on different schemes programs, those numbers are also there. Apart from that, I mean, these are all estimates at the end of the day, because some of these things might not have been finalized, and the actual expenditure for the last to last fiscal will also be there. So we can look at these revised estimates, and from this we can get an idea where all government prioritized last year. So if you look at healthcare, here also there are multiple schemes, multiple programs, and if you observe, in many places the spending has not increased despite it being a year of pandemic. So last year there was a massive increase in the central sector schemes, the spending on central sector. I'm not talking about centrally sponsored, but central sector schemes. And again, the budgetary estimate for last year was around 9,700 crores, but it increased to around 23,000 crores. So that means around 1.5 times. And what was the money spent on? It was primarily for COVID emergency response. Again, a large part of it was spent on National Rural Health Mission. Then if you look at National Health Mission, here also, again, there was slight change in the revised estimates, but not much. Around 5% increase was there. Also, when it comes to the research part, I mean, within the Ministry of Health and Family Welfare, there is one department for health and family welfare. There is another department for research. Here also there was an increase in spending. Almost it became twice, from 2,100 crores, what the budgetary estimate was this. The revised estimate is around 4,000 crores. So almost double. So somewhere it shows that the government last year prioritized a lot on health research, specifically on medical and public health. So these are some areas where the spending was more than what was expected. But one thing that I found interesting, or I mean, I don't know, it's something which is unfortunate maybe. At present, we have a scheme which provides health insurance, the Ayushman Bharat. Under that, you have Jan Arogya Yojana. So the budgetary estimate was 6,400 crores for last year. But the revised estimate is almost half of that, 3,100 crores. So I don't know why health insurance, which the spending on health insurance should have been a priority, or at least there should have been greater spending along these lines. Why didn't happen? I don't know that. So almost half is the revised estimate of the budgetary estimate. So these are something which was interesting that I found. Some areas there has been increase in spending, especially related to COVID response. But then there are some areas like health insurance, the spending was less.
Yeah, I mean, those are interesting statistics. Talking about last year's budget for Ministry of Health and Family Welfare, there was a lot of criticism because there was only a 10% hike compared to the previous fiscal year, which is 2019 to 20. And many economists pointed out that because the inflation was 7.5% at that point of time, like most of the budget would have gone in offsetting that inflation. So this year, the Ministry of Health and Family Welfare, it has been allocated around 73,932 crore rupees, which again is a 10% hike from last year. So do you guys have any insights on what the inflation rate is and how much the effective the hike is?
Yes, Sunila. So I think we have to sort of give some benefit of doubt to the finance ministry, because we all know that this has been a challenging times, especially for our economy. And just consider this number: the revenue receipts came down from 20 lakh crore to 15 lakh crore this time, while at the same time the expenditures have gone up from 30 lakh crore to 34.5 lakh crore. And what should be appreciated in this budget, one aspect that should be appreciated was that the Honorable Finance Minister was very transparent about fiscal deficit numbers. Now, coming back to the point the point that you have made about the 10% hike in health spending, we need to unpack this health spending thing to more sort of detail and a nuanced manner. So this time, the finance minister announced a new health scheme called the Pradhan Mantri Atmanirbhar Swasth Bharat Yojana, with a total outlay of around 64,000 crore. right? The union government's allocation to the health ministry of 2020-2021 was 67 crore, which means that there is a 100% increase in the entire health allocation. Now, this is the speech that we all heard. But if you go to the annexure of the budget and you try and find out the details of this thing, you won't find the mention of this scheme in this financial year's expenditure. Which so it's not clear whether whether this will be the spending will start happening this year or over the next 6 years, which by the way is the total outlay of. So 64,000 crore over 6 years, not for the immediate 1 year. That's one thing. Another interesting sort of fact that has been sort of appreciated and celebrated everywhere was that magic number of 137%. So the government announced that the total outlay of healthcare will be around 2,23,000 crore, which is an increase of 137% as compared to 84,000 crore previous last year. We need to be very careful when we read this number, because actually this whole outlay is actually the outlay of several other verticals. So we have Health Ministry, Ministry of Health and Family Welfare. We also have Ayush Ministry. We have Department of Drinking Water and Sanitation. Also, we have a very interesting and an additional feature this time, allocations by Financial Commission for healthcare, which was a huge sum. We also have a very different kind of an expenditure to the water and sanitation department. And we also have an allocation of money for COVID-19 vaccine this time. I think it was around 35,000 crore. So if you collect and compile all these vertical heads, all these verticals and these heads, that will give you a number of 2,23,846 crore to be precise. If you look at the spending, the increase in allocation to Ministry of Health and Family Welfare, this is, as you said, rightly said, it is actually merely 10%. So from 67,000 crore, it has gone up to 73,000 crore. So this is something that we need to be, and the listeners need to be very careful about while reading these numbers.
And also one thing I wanted to point out, I mean, this is, if you look at the budgetary estimates, if you are comparing the budgetary estimates, then there is an increase. But if you compare the budgetary estimate for 21-22 with the revised estimates of 2021, there has been a decline. So again, the revised estimates for the Department of Health and Family Welfare was around 79,000 crores. Now it is around 71,000 crores. So there has been a decline in this. And one more thing. So as Apurva pointed out, that the allocation of the Department for Drinking Water and Sanitation has also been brought under this fold. See, I don't see anything fundamentally wrong in this, in the sense that at the end of the day, health outcome is a result of multiple factors, right? It all and health and sanitation, water and sanitation, nutrition, all these things can lead to better health outcomes. So I don't see anything fundamentally wrong in putting it like this, but claiming that we have increased it by 36% might not be right. In the sense that, see, last year also there would have been some allocation to the Department of Drinking Water and Sanitation. So what you can do is you can compare that with this, right? Last year, what was the allocation to drinking water and sanitation? This year, what was the allocation to it? That comparison you can do. And here also you can see there has been some increase, because last year some 18,000 crores were allocated to this department. This year it has been 60,000 crores. So 40,000 crore has been the increase in allocation. Maybe we can account for these kind of things rather than just saying that all these things should be part of the, we should be taking credit for all these increased allocations.
I agree with you, Sarthak, totally, because saying 137% increase in the health budget when you are actually combining all of these verticals, and when like last year you did not use these same standards to actually calculate the health budget. So if this year they're combining all of this, they should make it clear while saying that we have increased the budget by 137%. I also wanted to talk about this Atmanirbhar Swasth Bharat Yojana. Now, it's a new centrally sponsored scheme, and it is mostly to develop capacities of primary, secondary, and tertiary healthcare systems and to strengthen existing national institutions. Now, the finance minister has said that this will be in addition to National Rural Health Mission. But I am a little confused here because the aim of National Rural Health Mission is also the same, that is to improve the public health system and to improve the primary, secondary, and tertiary care facilities. So I am just worried that those two schemes might interfere with each other. What do you think, Apurva, about this?
So, I think everyone who was reading the budget document that day was slightly confused, and everyone has have her or his set of apprehensions. And the thing is this: that what I mentioned in my opening statement was that this outlay of 64,000 crore is for 6 years, over 6 years, and in this particular budget, there's no mention of this particular scheme. So is it going to be implemented from this year, or is it going to be implemented in next year, or some of the schemes will be clubbed into this? These are the modalities that are not yet clear right now. And certainly there will be, they have said that they will be upgrading, preventive, curative healthcare infrastructure and other things. Clearly there will be duplication. But as the old adage says, the devil is in the details. So we don't know the details. The detailing will be out probably. The details will be clear when the Ministry of Health and Family Welfare will come out with its own recommendations.
Sunila, one thing, generally what happens is whatever is announced in the budget, right? The most prominent schemes. So for that, within the budget also, there is one more framework, the output outcome framework. Here what happens is for each and every scheme, they will mention what is the intended output, what is the intended outcome. Generally, if you look at the annual financial statement, the main document, here you will only find the outlays, how much amount of money we are going to spend on different schemes. But the other part of the budget is the outcome and output framework. Here they will mention with the same amount of money, what is the output that is expected, what is the outcome that is expected. All these things are there. But for this particular scheme, you do not have any such numbers. So again, that's the problem. You can make an announcement, and with how much output will be there, you don't know. So again, judging all these things will be difficult unless you have some benchmarks.
Right. That's right.
Also, I would like to sort of digress a little bit, and as Sarthak a short while ago, he talked about water and sanitation outlay. I think the water and sanitation outlay this year has been quite high, and it has been quite high over the past 5-6 years. And there is a reason to it. There is a political economy sort of a reason to it, because if you see that the current government, what it does is that it through its own welfare scheme, it provides citizens private goods, so toilets, bank accounts, probably through Ujjwala scheme. So these are private goods. These are not public goods. And there has been a deliberate attempt over the past 6-7 years that using these centrally sponsored schemes, you invest a lot into these schemes so that these private goods are being provided. Now, why should they be providing these private goods? Because A, these are tangible, these are visible. The outcomes / outputs are also, they are also tangible and visible. And it also helps in, if I may use the word, getting votes. And this is something that economist Arvind Subramaniam has talked about. This is the new welfare policy of India. So this is very different from the earlier welfare policies, which was based on rights and entitlements. This is based on these sort of tangible outputs that you keep on providing to its citizens. It's good, it's bad, can't say. It's only an expert can say. But this is what it looks like.
So moving on, there are other things as well that have been covered under the health and well-being budget. And one of the most important things here is nutrition. And for nutrition, the finance minister announced that to strengthen the nutritional content, delivery, outreach, and outcome, they will be merging the supplementary nutrition program and the existing supplementary nutrition program and the Poshan Abhiyan, and they will be launching Mission Poshan 2.0. And they will adopt an intensified strategy to improve the nutritional outcomes across 112 districts. So the details of this mission Poshan 2.0 are not known. So we will have to wait and see what exactly is included under that.
Sunila, one thing here, what they have done is previously there were multiple schemes under the Integrated Child Development Scheme.
Umbrella
ICDS, right?
Right.
ICDS. Under that, you had Poshan, you had schemes for adolescent girls, and multiple things were there. So now they have just gone ahead and they have announced that we will be having Saksham Anganwadi and Poshan 2.0. So they have kind of repackaged it. But what is interesting to note here is the budgetary allocations have been curtailed. Last time it was around 28,000 crores for the umbrella ICDS. Now, I mean, they are repackaging it, but the budgetary allocation is around 20,000 crores. So almost, good amount of reduction, almost 25% reduction has happened for that scheme as well.
That's worrisome if there is a reduction happening there.
And mind you, this has come at the backdrop of the latest NFHS report that claims that out of 18 states that they have got reports data of, nearly 25% students are stunted. So reduction in allocation is really worrisome.
Yeah. And on top of that, when you're talking about kids, right, the allocation to midday meal scheme has been less as compared to the revised estimates for last year. So there has been reduction in that as well. And nutrition and all add to the health outcomes, right? So maybe I thought it was useful to point out the reduction of midday meal as compared to revised estimates for last year has also decreased by almost 10%. But what is interesting is there has been a specific allocation for vaccines. So around 35,000 crores has been, again, that is a separate allocation for vaccines. But again, the question is how much, is it sufficient to roll out vaccines throughout the country? So since Sunila, you have worked on vaccine related projects, what do you think? This 35,000 crores will be good enough?
It's really difficult to say that. We already have 2 vaccines that are rolled out now. One is the Covishield and other one is the Covaxin. And the finance minister said that they are planning to roll out 2 more COVID vaccines. So with 4 vaccines in the market, I'm really not sure if 35,000 crores will be enough considering the population, the scale of population we are looking to cover. So it's really questionable at this point of time.
Yeah, so this 35,000 crore, we are not very sure whether it will be good enough or not. And we have been talking about budgetary allocation for the last 20 odd minutes, right? So we have been talking about whether the spending has increased, decreased, all these things. Now, the point is, all these things tell you a part of the picture. It tells us that what is exactly the priority of the government, what are the government's intentions. And generally the discussion is around that. But one more thing we need to take care of is whether these budgetary allocations are leading to changes in outcome, because that is what we should be aiming for. Now, many times what happens is you will have some budgetary allocation, you will have specific allocation for certain scheme, but not necessarily you are going to meet those outputs, or not necessarily you are going to get the desired outcomes. So only discussions around the budgetary allocations might not make sense. So we need to look at the outcomes that we are intending. We need to look at the outputs that we are intending. Output is basically something which is easily quantifiable. Outcomes are something which take longer time to measure. So we need to look at these dimensions as well. And along with the budget, you also have a framework which talks about all these things. And that is also something we need to analyze. And one thing that I found, I was looking through it, rough analysis of that I did. And I found out that in some cases, the budgetary allocation has remained the same. So last year also you were saying that we are going to allocate this much amount of money for a particular scheme, but the output has been changed. For example, if you look at Pradhan Mantri Jan Arogya Yojana, which aims to cover people, which aims to provide people some sort of health insurance coverage. So last year, the target was with 6,400 crores, we are going to cover around 1.2 crore people. But this year, the budgetary allocation or a budgetary estimate is same, 6,400 crores, but the output has been reduced. Now the aim is to cover around 81 lakh people. So again, we need to look at these numbers also, because at the end of the day, money might not get translated into the right kind of outputs and right kind of outcomes. So this is something that, again, policy enthusiasts and those who are interested in this domain of health policy should also be looking at, rather than just looking at the numbers, which generally people do.
Right. Totally agree with you. So what Sarthak said about, money not necessarily translating into outcomes or outputs, I totally agree with that, because to add on to the example of Pradhan Mantri Jan Arogya Yojana, we can talk about telemedicine as well. The budget allocation for telemedicine has been stagnant. So last year it was 45 crores. This year again it is 45 crores. And all of us know, because of COVID-19, there has been a massive uptick in the demand for telemedicine consultations. And considering that the budget hasn't changed is a little bit disappointing to know. So concluding this, I want to say that it's really great that the government of India presented the budget for health and well-being, as a holistic thing where they consider all the factors such as nutrition, clean air, water, and sanitation. However, as Apurva said before, the devil lies in the details. So, all of the buzz that is happening around the 137% hike, we need to be very aware while using that number. So that's all for today. Thank you to our listeners for listening to All Things Policy, and thank you Sarthak and Apurva for being on the podcast.
Thank you.
Thank you.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.
I hope you enjoyed that show. If you aren't following us on social media, please do. We're IVM Podcasts on Twitter, Facebook, and Instagram. I'd like to thank the sponsors on the network this week, Storytel and The Whole Truth Foods. Thank you for supporting us. So, great week on the network again this week. Definitely do check out the Pragati podcast. Pavan spoke to Krish Ashok. They discussed science, knowledge, and the wonder of Indian home cooking. Staying in the realm of food, on This Round is on Me, we had AD Singh as a guest. Gauri and AD discussed the 10 years anniversary of The Table and the 20-year anniversary of Olive. So two of Bombay's biggest restaurateurs have a conversation about the restaurant business. All Things Policy celebrated 500 episodes on January 27th. Manoj talks to Aditya and Anirudh about the surprising origins of the podcast, its evolution over the last few years, and its exciting future. This episode also marks their video debut, so definitely do check that out on YouTube. On Storytellers and Storysellers, Vineet talks to Ranjit Pratap Singh. Ranjit is the co-founder and CEO of Pratilipi. Pratilipi is a company that's recently acquired IVM, and Ranjit on this episode discusses his plans to build a homegrown media empire, his love for comics, and how India can have its own comic cinematic universe. And finally, Cyrus had an exciting week. We had some amazing guests this week. We had Vishal Gondal come and talk about Fauji. We had Atish Tathir talk about the various issues that he had been facing with his OCI card and other things like that. We had Adam Dow talk about things going on in the US and the evolution of what's happening there. We had Siddharth Kannan come and talk about his history with Cyrus and his new show. So definitely do come check that out as well. And with that, I hope to see you again next week.
Do you wonder what goes inside the mind of an achiever? How do they manage to get back up on their feet in spite of their failures? Do they really do something different? You're absolutely right. Yes, they do. I'm Aditi Surana. Join me every Wednesday and Friday on my show Absolutely Right, where I use my special tool of handwriting analysis, also known as graphology, to interview high performers and study secrets behind their success and personality. You can catch us on the IVM Podcast app, website, or wherever you get your podcast from.